Thiazide and thiazide-like diuretics. A thiazide-like diuretic is a sulfonamide diuretic that has similar physiological properties to a thiazide diuretic, but does not necessarily have the same chemical properties of a thiazide. So it's lacking the benzothiadiazine molecular structure. However, thiazide and thiazide-like diuretics are considered equivalent in their effects. So they basically do the same thing, it's just that they have different chemical properties. Mechanism of action of thiazide and thiazide-like diuretics. As you can see in this picture, this is where the thiazides work in the distal convoluted tubule. So how does it work? Well, it works by inhibiting the sodium, potassium, and chloride reabsorption in the distal tubule or distal convoluted tubule and reabsorbs calcium, sodium, and chloride, and it results in water loss and therefore decreasing preload or filling pressure. It is also considered a direct vasodilator. It directly dilates peripheral arterioles, which means that it decreases peripheral vascular resistance or afterload. Therapeutic effects include increased excretion of water, sodium, potassium, chloride, and bicarb without altering the pH or the acidity. In addition, it causes peripheral arterial dilation or basically the dilation of small branches of arteries that leads into capillaries, therefore decreasing PVR or decreasing afterload. So again, what's afterload? Afterload is the resistance that the left ventricle must overcome to circulate blood. In addition, another effect is because of the decreased fluid volume, it decreases preload. So decrease in filling pressures, decrease in volume of blood in the ventricles at the end of diastole. Some indications include hypertension and fluid overload or edema and adjunct treatment for heart failure. Some precautions include impaired renal function, pre-existing dehydration, pre-existing electrolyte disturbance, most specifically hypokalemia, and some contraindication include chronic renal failure and untreated dehydration or electrolyte disturbances. Side effects or adverse effects include 1. Electrolyte disturbances. So there can be decrease in potassium and increase in calcium. So most of this is actually dose related, so the higher the dose, the higher the likelihood for electrolyte disturbances. It can also cause headaches, dizziness, impotence in men. It also increases lipids, glucose, and uric acid. So it has an elevating effect on the blood lipid lipoprotein, and it increases glucose for an unknown reason why. And some studies state that it is possible that it increases insulin resistance and it inhibits glucose uptake and at the same time decreases insulin release. In addition, it also decreases excretion of lithium. So there is a risk of lithium toxicity if somebody is on lithium and we start them on thiazide or thiazide-like diuretics. So again, it is very important to obtain that history, and once you have lithium on their medication list and the doctor or provider is about to prescribe thiazide or thiazide-like diuretic, it is important to take note and notify the doctor and even the patient about that. And they may need to consider giving another medication if there are other options. That way they don't have to disrupt the lithium levels, especially if it's been therapeutic for quite some time. Nursing actions include assessment of blood pressure, intake and output, BN creatinine, potassium, magnesium, and calcium. And again, very important, you want to make sure that you have an accurate medication history, especially if the patient is on lithium. Examples of drugs in this class, the ones that you have to know. So on the thiazide, you have hydrochlorothiazide or hydrodiuryl. That's a thiazide. When it comes to your thiazide-like, so again, thiazide-like are similar when it comes to their physiological properties as a thiazide diuretic, but different when it comes to their chemical properties. An example of a thiazide-like diuretic is metolazone or xaroxolin.